Hey guys, it's Natalie, and this is the HealthTech Hotseat. Today's episode is for any clinician, a doctor, PA, NP, respiratory therapist, pharmacist, anybody in healthcare who is interested in transitioning their skills to work in health tech. My guest today is Dr. Raihan Faroqui. He is an internal medicine physician in New York, now working exclusively in health tech, currently leading partnerships for Confido Health, a voice AI company. This episode freaking rocks, guys. It is filled with so many good tidbits for anyone excited about the future in health tech and looking to see how your clinical skills can translate to real gains in industry. Without further ado, please enjoy my conversation with my amazing friend, Dr. Raihan Faroqui. Hey guys, it's Natalie. We're live at HIMSS 2026, and I have with me my incredible new friend, Dr. Faroqui.
Oh,
so
thank you.
happy that you're able to be here.
Yeah.
It's the HealthTech Hotseat, and what I'm super excited for our listeners to hear from you today is you have such this incredible story of this MD training background, now in health tech, really in truly business development.
Yep.
So tell our listeners a little bit about you, what
Sure.
you do, and how you got here.
Yeah. So I'm trained as an internal medicine physician. I have half an MBA from undergrad.
Nice.
I was always fascinated with the kind of healthcare macroeconomics, how the money moves in our system. And for me, as I saw a lot of consolidation happening, hospitals buying up clinics, physicians feeling a loss of power, the potential of technology to change how care happened, I got really curious about what the other side, could look like. I've always had this kind of vision for being an entrepreneur, for being an innovator, for, disrupting things and really having that impact, just kind of being able to scale from patients to populations. I'm very much a digital native physician. I left right after residency many years ago, and it's been great.
Nice. So, I'm really curious about that jump from clinical care residency, complete residency, going into health tech.
Yeah.
If somebody is watching this right now, like a clinician is watching, it's a physician or a non-physician provider, or maybe someone else, right? Because there's so many different kinds of job titles that could work in health tech.
Yeah.
But what would you like to say to younger you?
Sure.
Or that person listening today that's like, I'm interested in health tech.
Yeah. So I think the first thing is, and I'll be fairly candid, is that the grass is not always greener. So I see a lot of burnout from clinicians in practice, whether they're at a hospital or at a clinic. Again, they have this loss of autonomy. I'm working more, I'm getting paid less. I'm documenting at home. That doesn't necessarily mean that a job at a startup is going to have a lot more freedom and less anxiety, right? So I think first thing is very clear. It's like, what gives you satisfaction? Like, what is your purpose? And I think the second thing is, if you are like really convicted on making that transition, so there's like three things. Number one is your network is your net worth. I, 8-10 years ago, pretty much hit up everybody who I knew. I leveraged LinkedIn as a channel. I, cold outbounded to companies that were hiring. I networked with people I network with people who I wanted to become, if that made sense. Folks who were 3 to 5 years ahead of me, folks who were chief medical officers, SVP of partnerships, founders, investors of companies. Just putting yourself out there, I think, is super important. So attending conferences, going to events, going to happy hours, setting up one-on-one chats, joining Slacks, reading newsletters, understanding who the movers and shakers were, and just going there and meeting people, right? So kind of being very fearless about that, which is very daunting for a lot of people. Now, what I very quickly realized is, secondly, is what do I have to offer? Yeah. Oftentimes folks are like, I want this, but it's kind of similar to marriage. It's like, and we're both married. Yeah. It's like, it's not just, I want this from you. It's like, what do I have to give to you? Right.
Wow. Mm-hmm.
So what I realized is, in health technology, clinicians have 4 or 5 things to give to a company, right? They can obviously be a clinician, but folks can give their skills in kind of administrative affairs, so operations. Folks who are really well organized, are good at hiring people, they're good at building protocols, building workflows. Clinical operations is a great place where you could give those skills, right? Product, as we're now seeing a variety of tools that are being built, for clinicians and for patients that need clinical input. So working with developers and designers and engineers kind of building a new software tool or AI-enabled tool. And then lastly is sales, business development, partnerships, go-to-market strategy, which is a big one that folks oftentimes will undervalue or they see as something that's below them or beneath them.
Interesting.
Yeah,
Okay.
yeah. I think there's just this reputation of sales being kind of very inferior to like the training of a physician. There's like this very interesting like interprofessional like view, and I don't know where that comes from. But physicians obviously have very powerful networks of physicians that companies want to market and to sell to, right? So again, your network is your net worth, right? Oftentimes companies want to sell to department chairs, chief medical officers, physicians who own their own outpatient practices. So you're a gold mine, right? So I counsel folks all the time that you should be really curious about opportunities in business development and sales because you have these relationships, you have access that folks who just showed up to healthcare don't have.
Yeah, they're not going to have. And often
and you have the trust.
You have the trust and you have networks that likely are probably from years of camaraderie, right? Like program training from residency. You're in the trenches with people. They really trust you.
Yes.
It's an interesting perspective on BD and on GTM, go to market.
Yeah.
And something else that I always think of is like, how do we talk about value? How do we communicate the value of a product?
Sure.
Do you feel like that value messaging fits under more product? Does it fit under more GTM and sales? Where does something like that fit in?
No, that's a really great question. I say there's basically two things that kind of tie product and kind of sales together. It's obviously like what is the product's value proposition, and then what is the clinical and financial ROI. And that's really, really important. And I think that framework kind of ties both things together. I've seen a graveyard of products that were really cool, but nobody wanted to buy. Right? Because there was no ROI, right? How is it improving revenue capture? How is it decreasing cost? How is it improving quality? So on and so forth. So if you're not doing that first, if you're actually not having conversations with buyers and customers, oftentimes it's not clinicians, it's people who are in C-suite, right? CEO, COO, CFO, chief strategy officer. It's like, hey, is this a problem of yours? Sure, it's a problem, but are you actually willing to pay for it, right?
Yeah, who's going to put money for it?
Who's going to pay for it, right? And then again, what's the ROI and the value that you're getting for that? Again, there's so many problems in healthcare. Unfortunately, there isn't always a buyer who's willing to pay to solve that problem.
Have that solution solved.
So I think for people who are transitioning into healthcare technology, that's a very important thing, to keep in mind. It is a for-profit industry, and the idea that there has to be some financial ROI. And again, it's not like a dirty thing. I think a lot of clinicians again are very kind of put off by that. They're like, I just want to do the best possible care for my patients, and like everything else will take care of itself. And that's just not the case.
It's not. It's really not. And I second that. I want to like remove that stigma because at the end of the day, everyone's got to eat, right? We know that term. And I think that thinking of it intentionally, building a product and then creating this value prop, whether it's clinical value or operational ROI, and then building that into GTM, that's so essential. You'll never scale if you don't do that.
Yeah, and then what I'll add is you need to. It's this DIY education that you have to embark on. There are some resources that I'm happy to share with your followers. Clinics Academy, run by my friend Alex Moseni, is really great. It's basically a mini MBA for folks who want to get into health tech, and it basically prepares people to become medical directors and chief medical officers. Again, what's really important is understanding the macroeconomics. That's so critical for a lot of clinicians who are like, I have no idea how that works, right? Like I can diagnose a patient, I can treat a patient, but I have no idea how reimbursement works, how kind of health plan negotiations work, things like that. Really important. The second thing is policy and regulatory. It's so critical. The laws that we have very much incentivize clinicians and corporate entities to do things or not to do things, right? There are penalties. So it's really important to start educating yourself on, various laws that have come about, right? Whether it's a law that, created the ACO or high tech with EMR, a variety of laws that are now coming up in AI and governance, right? All the various telehealth and hospital at home legislation. Again, it's not an area that many folks might be interested in, but it is helpful to start getting curious about, hey, here's this law or regulation that exists. Like, I wonder what incentive this is providing for companies, or providers to do something or not to do something.
If we have founders or, development teams watching this, what would you like to teach them about how to engage clinicians and the type, I think you kind of already touched on how clinicians can be, helpful in this kind of situation, but how do they engage those people? How do they vet those people? How does that work?
Yeah, it's a great question. So I think especially for first-time founders in healthcare, there's a very toxic trait, and I'll be very honest, where folks will email you or shoot you a note on LinkedIn and being like, hey, I want to pick your brain for 15 minutes or half an hour. And it triggers me all the time, right? So clinicians are valuable. They're also really busy. Always compensate people for their time and their advice. So I think that's really important. So especially when I get inquiries from folks who are like, hey, like this is your background. I'd love to spend some time, but oh, by the way, like what's your rate, right? I find that's like a very respectful way of having a conversation with a clinician, right? And actually that's just how like pharma and biotech operate, right? So I think for health technology startup founders, that's very important. It's like there's a proper decorum when speaking with either an academic clinician or somebody who's in industry, and you want to get their feedback because again, you want to take that feedback to build a product, or you want to take that feedback to sell a product. That's very valuable, right? And that should be compensated appropriately. Yeah.
Can I ask a follow-up to that though? So this is a hot take. Are you ready?
Yeah, sure. Always.
Give me your honest answer.
Yeah.
What do you think though about founders who are like MVP or even pre-MVP? They're still in needs discovery.
Sure.
So should we, as physicians and non-physician clinicians, be expecting those people to put up compensation when they're in needs discovery?
Yes. So it doesn't matter at what stage a founder is in, right? So I hear this all the time. It's like, hey, I just launched a company. I'm bootstrapping. And?
Yeah. Yeah.
What's your point?
Sure.
Like that doesn't excuse you not fairly compensating the other person for their time and for their wisdom.
Yeah.
Right. And so again, it's I think the offer is extremely important. So again, whether it is, a cash rate, whether it is equity, whether it is like, hey, I'm happy to take you out to dinner or something like that. Again, just having that. Yeah.
Humility to put forward, like you deserve to be compensated.
That's right. And that doesn't have to be monetary.
Yeah. I hear that. I agree with that.
Or it's like, look, I'm happy to, for this time, if you have something that you're really passionate about, like I'm happy to market you, or I'm happy to plug you. Like some offer. Yeah. Right. And again, that's not what people come with, because folks are very transactional, right? And it's not valuing the time from the other. So I am like very defensive about this to a lot of people who I counsel. Yeah.
I think that's great, and I think there's someone I'm connected with, Andrew Ludquist, and he always is the same way. Like we devalue all of our opinions when we're just willing to give it away for free.
Absolutely.
I love that.
That's great. That was great. Maybe a special guest walking through. But I will say, like, I'll be candid. Like I've of course. I don't monetize every interaction or conversation. Again, I think it's all about the way that somebody is approaching you. Right? Yeah. Folks I've seen are, and I think the smartest founders are really humble.
Yes.
They're very relational. They're offering things. They're trying to help me, right? Yeah. It's like, hey, for this time, I'm happy to do X, Y, and Z for you. Now, maybe I haven't been paid, but I still feel like my time was valued. And that's right. And I think that's what's important.
That's what's important. And we can even take that and extrapolate that into like burnout in clinical care. Yep. People are burned out when they feel like you don't value their presence and the work that they're giving. Sure. And so I think, it correlates to this spot on.
Yeah. Like here's a pizza party is not value. No. Right?
No.
It's like, hey, I'm going to pay you more. I'm going to let you go home on time and have dinner with your kids. Like, and then I'll let you control your schedule. I feel valued. Yeah. Exactly. And oh, by the way, like you tell me what you want.
Yeah. Yeah.
Right? Like we're not just going to tell you what to do.
Let's problem solve together. That's right. Let's, when things are really hard, let's send an email and acknowledge that. Yeah. There's a lot of way that we can show value to the people around us. I love that. I think that's a great take. I think that's appropriate. And I think that gets pushback though. But I think it's not doesn't mean it's wrong.
Yeah.
I think it's actually
and look, like I applaud founders shooting their shot, right? Like you should I'm always trying to get stuff for free. But that doesn't mean there isn't a proper way, that there isn't a decorum of going about that business. So one great example there is mutual introductions, right? That's what I love doing. So, for folks who are looking for an opportunity or for a position or who are looking to network, hop on LinkedIn, right? look up who you have in common with that person, shoot that person like a really sincere note. It's like, hey, I'm looking to connect with this person for this very reason. This is my ask. Can you make the introduction? And that is a way higher success rate of, going cold. So as I've kind of built up my network and career, I've just, over and over again, relied on that warm introduction, method to get access to pretty much anybody who I want.
I love that.
Yeah.
No, and being bold in, we have something to offer and we have to find our own value proposition.
That's right.
And it's a combination of like what we like, what we're good at, our educational background and our experience background.
That's right. Yeah.
And then putting that together to say like, this is what I can offer you.
And I think the other thing that I'll say is that, again, physicians have been trained to tell the story of themselves as part of an other. So what does that mean? So, and you hear this, it's like, well, I went to NYU for med school. I went to Penn for residency. It's like, you're not taking ownership. It's like the institution is what kind of defines you. So what I oftentimes tell people is that you need to kind of build the story of yourself that is not based on your, your training or your work experiences, right? Like you're not just a ophthalmologist who trained for 10 years at these places. Like you have professional interests, you have research interests, you may have some really like interesting skills to offer. Like list all of those things and kind of build a narrative for yourself. And I think that really helps folks transition into the unknown, right? Because it's not as simple as, oh, okay, well, here's like an application portal. I'm going to drop my application. I'm good to go. Oftentimes you're like making your own job. I mean, a lot of my jobs, I've made my current role. There wasn't a role available. There wasn't a job description. I had a relationship with the CEO and I kind of shot my shot and, so.
And it worked out. Look at you now. Yeah. I love that. And being like, what do I have to offer? Being humble in and of ourselves, right? And knowing that we can serve roles in so many different aspects and stages of health tech development.
That's right. Yeah. I mean, a lot of folks in health tech are the misfits, the odd ones out. What I mean by that, we're pretty weird. But that weirdness is the superpower, right?
Yeah.
So I've met several physicians who are like, hey, I have a background in computer science and I can code. Folks have been like, hey, I love designing things. Other folks have said, hey, again, like I used to sell all kinds of things on the weekend. Like that was my side hustle. Like those are your superpowers. It's what makes you really, really unique. And I think those are the things to, kind of tap into. Like I've always loved social media and marketing and like public speaking. And I didn't know I could use that like professionally in my career. So it's like, whatever it is, like your talent or your skill outside of medicine, that oftentimes is a part of your story of yourself that will make you really attractive to companies.
So Raihan, you are in the HealthTech hot seat. Give me one AI hype that you've seen at HIMSS you're calling BS on.
Okay. So every company is now an agentic AI company, where last year every company was an AI company. It's funny kind of walking around the booths and the show floors, seeing that word agents or agentic kind of slapped on everywhere. It's probably 75% hype. I don't think most of these companies are truly building these tools. They're probably Claude coding something. They're white labeling something, and that's fine, right? But if you've been around for 5, 7, 10 years, like don't pretend you're now just like an agentic AI company. So it's like the flavor of the month.
It's agentic AI. Now, do you feel though that agentic AI is legit on the healthcare scene? Like its use case is legit.
It's, I think when I kind of zoom back to 5 or 10 years, what I've realized is that the tech is always like 2 to 4 years ahead of where the industry is in terms of adoption.
Okay.
So what that means is, so I remember like when like telemedicine started to get really hot, it took a while for that to fully get implemented. I remember when scribes first came out. Now this was pre-ChatGPT. It took a couple of years for scribes to kind of finally get implemented, right? That's where I feel agentic AI is right now, where last year folks started to kind of get curious and pilot it. Right now, some people are like implementing it, but we won't really see the impact 2, 3, 4 years down the line. That's just what it takes for the diffusion of technology in healthcare. So for me, like that's the humility that I always keep, even though AI and agents, when you look at the agenda, it's like 75%. That's just not where the majority of the industry is right now. Like if you were to ask the CEOs of the top 10 health systems, what are your top 3, goals this year? you're not going to see agents AI on there, right?
Yeah.
It's going to be your very typical things like, right, we need to shore up revenue cycle management. We need to improve our margins. Yeah, we need to work on workforce stability and like clinician retention. And then, AI might be like number 9.
Yeah.
Even though it is like very much part of business strategy now and maybe the first 2 or 3 areas, there's always this lag that happens. But I will say though, I am seeing kind of that lag get shorter, where when you do have this foundational technology, I'm seeing folks experiment with it a lot quicker than they ever have. Like let's say compared to 2015, when something new came out, folks were like, I don't know about this. But now, I think just the ethos of like innovation piloting, experimentation has been fairly rapid. Like I'm at an agentic AI company, and we sell to outpatient providers. But it's all about ROI for our customers, right? Yeah. They're seeing more patients, they're decreasing their costs. So it's like if you're leading with ROI, again, it's not about the tech. It's like if you're leading with the ROI and the impact to patients, physicians, caregivers, admin staff, like that's what kind of moves the space forward.
It's about leading with the value. And leading with value that lands with your individual stakeholders.
So I think that's what I've seen that's very different from previous innovation cycles, where folks were like, here is this new, shiny new tech. Let's just talk about it ad nauseum. Where I think now the conversation is very different. It's like, here are our P&L problems. Here are the solutions that we need. And oh, by the way, these are the technologies that can help solve those things. And agentic AI is one of those things. It's not the only thing, right? As I mentioned earlier, like, this is why getting curious about healthcare macroeconomics is so important, right? It's like looking at the profit and loss of an institution, whether it's a hospital, it's a clinic, it's biopharma, it's an employer, or it's a payer. Like those are the business realities and pressures that afford companies to build solutions, right? And there's not that many problems financially, right? It's like,
no, you're right. You're right. Yeah. And I feel like encouraging founders to be curious about that. Lead with the problem, not with the product.
That's right.
That's
right. That's absolutely right.
Question for that though. Do you feel like that is this year, or do you feel like that has been kind of changing through the years?
It's definitely been changing through the years, where, like 7 years ago when I was kind of starting in the industry, I saw a lot of pilots that ended nowhere. Because founders were not doing really good customer discovery. They were just trying to sell what they had versus being very curious about what buyers wanted to pay for, right? That's really what true customer discovery should be. It should be very scientific, right? It's like, hey, I have, 15 buyers in a room, and I'm just asking them, is this a problem for you? Would you buy it? How much would you pay for it? Would you implement this now? Like those types of questions are super, super important. Which I find people are asking more now than before, because I think folks have learned there's also a lot of repeat founders, there's serial entrepreneurs. The company that I'm at right now, like this is the 5th company that I've been at, right? So I've certainly learned a lot as well in terms of how do you kind of position a product, how do you talk to buyers and understand, what their priorities are right now. That's really critical. So I've definitely seen that evolve over time. Just really understanding the kind of the problem set. But it's also the prioritization. Like that's important too.
Yeah, absolutely.
You know what I mean? I mean, there's
limited resources. We have to prioritize.
I mean, it's people, process, and tech, right? Like, and it's also what's in it for me.
Sure.
It's like aligning incentives. Another kind of hot take is that, for the bubble that's here, like innovation is amazing. For the vast majority of people, innovation is frightening. So why? So again, if you imagine, again, at a hospital or a clinic, the vast majority of people are like, I want to go to work. I want to do my thing. I just want to leave, right? Folks are not looking to change their workflows or their processes. The way that they're doing it, it's just fine, right? So then when you introduce something different, right, change management, that's actually pretty frightening and scary for the vast majority of people. And I try to remind myself of that all the time. Like that's why that humility is really important. So when you're speaking with a practice owner, an administrator, we work with front desks, so like receptionists and also with billers. That's like the reality that we have to like remind ourselves of. Like, like disruption is disconcerting for a lot of people, right? And even for clinicians as well. Right? I talk to a lot of older physicians, and they're like, all this stuff that young folks are doing. It's like the worst. Some of that is fear.
Yeah.
Some of that is actually like well placed, right? Because even just the way that we're training, the way that we're practicing is going to be a lot different.
It's going to change.
Yeah.
So we started this conversation talking about how we talk to clinicians, how we compensate clinicians as, health tech groups, health tech founders, companies.
Yep.
But then you brought up a really good point about talking to buyers. So if a founder or a tech development team is watching this, what is your, recommendation on how they engage? How do you engage a buyer in those kinds of customer discovery questions?
Yeah, this is a really good question, by the way. So hospitals put out RFPs, right? Look for those because, mid-market and enterprise accounts are very transparent about what their problems to be solved are. So I think it's really great.
And for our listeners that don't know what an RFP is.
Sure. A request for proposal, right? Which is basically, hey, we have a problem. Send us a proposal to solve that problem, right? They're public. You can go find them, right? So that's one idea. But again, I think like the framework very much is, don't be biased. So the idea is that, when you're building something and then you're trying to sell that thing, you have a lot of bias.
Oh, it's your baby.
Yeah. So, but that's why having either advisors or other folks who've been there and done that are really important. But even just understanding that framework for yourself, it's like having that humility of like, no one cares about your thing as much as you care about your thing. And that blinds you.
Yeah.
And I see this like over and over and over again. I've advised more than 40 companies. And I can't tell you where I've oftentimes I've had to have that like very difficult conversation.
Sure.
I'm like, have you validated this with anybody? Or is this just some hypothesis that you have and you're just going to go like into the wilderness and keep, like screaming into the wind?
Yeah.
Like, it doesn't work.
No, I know. And it's so interesting. It really touches on a part of humanity that's like, once we really latch onto an idea, once we believe our baby is so cute and not ugly, right? And it takes that outside perspective to say, like, let's hold the brakes for just a second.
That's right.
And let's examine this a little differently and make sure that we're shored up on validation or whatever.
So you're saying finding buyers. So again, I think both warm and cold techniques are necessary. So again, look into your network, find folks who have the titles. Now, again, I think this is also important. Oftentimes in, sales, parallel pathing is really important. You have to be able to, in parallel, talk to various decision makers. There's the buyer, the person who signs the contract. There's the advocate or the evangelist or the influencer, who has, like a big say, but they're not the buyer. Then there's the frontline user. It's very important to talk to all three or four. But I do find people over-optimize for the end users and the advocates, and they're actually not speaking to the buyer.
Buyers enough. Yeah, that's a really great point.
So for example, in a hospital, a lot of departments have budget, right? So that could be the department chair, that could be the director of finance, that could be the CFO. That's the buyer, right? Yeah. So it's really important talking to that person first, but also being very consultative, and I think that's important. So instead of being like, hey, I'm so-and-so, this is my thing. What I always say is like, be like CIA, always gather intel.
Okay.
Right? Like ask 10 questions before you talk about you or your thing.
Yeah.
It's important. So it's like, what are your buying priorities this year? What are your top 5 board priorities? What do you have budget to spend on? What do you want to implement right now?
There you go.
People are happy to tell you.
Yeah. And now, from your experience, are those conversations that you're leveraging your network to get in front of those people?
Yeah.
And are those conversations that are compensated?
They're not compensated. That's a very good.
So I want to know. I want to hear that.
Yeah, that's right. So.
And then what's the carrot for that part? Because we've been talking about, there has to be
what's in it for the buyer?
What's in it for the buyer?
Yeah, that's right.
So walk me through that. Like, I'm a buyer.
Yeah, sure.
So what is it in it for me?
So
have that conversation with you.
Always research who you're talking to.
Sure.
If somebody doesn't have a LinkedIn profile, go on their website. Find 2 or 3 areas of expertise that they have. Do a little bit of homework and maybe find some trends or insights into those areas. What I typically do is when I'm surfacing these warm introductions, I keep it very short. I'm like, hey, I want to talk to this person because I want to swap insights on X, Y, and Z. And the X is what you have in common. The Y is maybe what that person's interest is, and the Z is what your interest is. And that's my template, right? So in that conversation, yes, you're asking that person about, this intel that you're gathering, you're benefiting, but then you're then turning around and being like, hey, I saw that in your career or in your current role, you're doing X. I realize in the market, like this is happening and then there was this development. I'm curious what your take on that is.
Yeah.
Right. It's like a very nuanced.
No, I love that. Yeah.
So you're not having this like higher level academic or intellectual conversation. Guess what? People love that. People love when you took time to like read about them and came with something very, very specific. And I found folks are fairly open to having a conversation. Again, if the frame is right, where it's like not overly salesy, it's very relational driven, but you've done homework on that person. And again, you came like warmly recommended.
Warmly recommended.
From somebody in their network.
Yep.
Yeah.
So, maybe for the founder who is like, I don't have those network
I don't have that
connections.
network.
Yeah. How do you advise someone like that?
That's right. Again, start to understand where your buyer is. Right? If they're in administration, some type of capacity, go to a conference or an event where those folks have gathered. Find online places where those folks are speaking, right? Webinars or panels. Again, just show up, show up to where the buyer is. And then again, you need to be able to shoot your shot, right? If it's at a conference, you best believe, like I was that person who would sit in the first row, I would raise my hand, I would ask that like a really thoughtful question, I would go meet that person afterward. Like that's how you build your network, right? Person by person. Cold is very important. Like being able to craft a really good cold LinkedIn DM or a cold email, again, short and sweet, to the point, lead with value, and it's high volume, right? Like just sending 3 messages and getting 0 replies, like it can't make you upset. Sure. I mean, on certain days, I'm sending 50, 100, 150 emails. I've built some automated ways of doing that, but just manually doing that, is like a really good exercise. So just learning that skill of doing that. Again, it's a combination of both warm and cold. There's lots of tools that you can use, like Apollo.io, which is really great, where you can pretty much look up anybody's email address. You can find their title. Nothing prevents you from sending a cold email. Yeah, information out to people. It's just agency. This was amazing. This was seriously such a great talk. Do you have anything else for our listeners today? Like if you could, leave one other piece of advice or just something interesting or plug you and what you're doing. Oh, sure. Yeah, I'm happy to do a shameless plug. But yeah, I lead partnerships at a voice AI company called Confido Health. Our whole kind of purpose and vision is to, really bring back the joy to front office and back office teams. Missed calls leads to missed revenue at practices. So we leverage voice AI to basically automate a lot of those inbound and outbound phone calls. So we can do appointment management, scheduling, medication refills, insurance verification, and payment collections. We speak 20 different languages, work 24/7. Our agents never call out. And we service pretty much every type of outpatient specialty. So yeah, if anybody's curious about voice AI and how it can help. Nice. Yeah. And we'll link all your info below so people can connect with you as well. You can send them a cold message as well. Just make sure it's very well crafted. That's right. Okay? Yeah. Always open to DMs. Yeah. Well, this has been the HealthTech Hot Seat. Thanks so much for being with us today. Thanks for having me, Natalie.
Thanks for listening today, guys. Hope you enjoyed today's episode. My name is Natalie Friels, and this is the HealthTech Hot Seat. Catch you next time.